Hi, my name's David.
Hi.
I'm going to be your nurse practitioner today. For the first part of the exam, we're going to go ahead and ask you some questions, kind of to get to know you and see about your history. And then after that, I'll be doing a physical exam on you, and we'll move on to that portion, okay?
Okay, sounds good.
Okay, so what brings you into the office today?
I'm just here for my annual well visit.
Okay, great. Establishing care at the new doctor's office, great. So let me ask you a few questions. Do you have any concerns you want to talk about today?
Not really, just here for my yearly checkup.
Okay. Do you take any medications?
Yes, I have hypothyroidism, so I take levothyroxine.
Okay. So tell me about your hypothyroidism. Are you followed by a doctor for that?
Yes, I see an endocrinologist and I get blood work done every 3 months.
Okay, that's great. Have you noticed any weight changes from that?
I've maintained my weight over the past couple of years since I started seeing my endocrinologist.
Okay. And what about temperature control? Do you feel like you can regulate, you're not too cold too often?
I do tend to get pretty cold in the winter, but when I take my medication regularly, I'm usually fairly okay.
Okay, great. It's very important that you take that medication every day in the morning. Okay, so moving on, do you have any allergies?
No.
Okay. What about any intolerances to medication? Like, after you take any medication, does it make you feel sick or anything like that?
Nope.
Okay. Do you, besides hypothyroidism, do you manage any other chronic illnesses?
Nope, that's the only thing I have.
Okay. Any recent hospitalizations or surgeries that I should know about?
No.
So we're going to get to your family history. I want to know a little bit about your family. That paints a better picture for me as your practitioner.
Sure.
Can you tell me if any of your mother, father, or siblings have any medical or psychiatric illnesses?
My mother also has hypothyroidism, but other than that, no one has any other conditions.
Okay. And if you could, are your grandparents alive?
My grandmother on my mom's side has passed away, but that was from natural causes. But my remaining 3 grandparents are all still alive.
Okay. Anyone diagnosed with any heart disease or hypertension or cancer?
My grandfather takes medication for his blood. He's on blood thinners.
Okay.
And he had a recent valve replacement done. But otherwise, he sees plenty of doctors and he's well managed.
All right, so let's talk a little bit about yourself.
Sure.
Can you tell me about what's the highest level of education that you've went through?
Sure. I have my master's degree in occupational therapy, and I'm currently halfway done getting my doctorate in occupational therapy.
Oh, wow. And so do you work as an occupational therapist?
Yes, I work at Bridgeport Hospital, actually.
Oh, wow, that's great. And what about your current living situation? Do you live by yourself or do you live with somebody?
I am married, so I live with my husband, and we have 2 dogs and 1 cat.
Okay. Do you have any history of substance abuse?
No.
Okay. What about smoking cigarettes, smokeless tobacco as well?
No.
Okay. Any marijuana, medical or recreational?
No.
Okay. And how many drinks of alcohol do you think you have in a week? Or
I only drink socially, so if I go out to dinner, I might have a glass of wine, but other than that, I really don't drink.
Okay. So now we're going to get into some questions. I'm going to ask you basically how you're feeling overall to get a general overview of how your health is right now.
Sure.
Okay. Have you had any weight change recently?
I've maintained my weight over the past couple of years, like I said, with my endocrinologist, so
Right.
been pretty good with that.
Any fatigue or fever?
No, not really.
Any chills you have, night sweats?
No.
What about any chest pain? Do you have chest pain at all?
No.
Any palpitations you ever notice or edema?
Nothing that I would notice, no.
Okay, edema is swelling, so if you have
Oh,
that.
okay. Yeah, I don't think so. I've never felt that.
Have you noticed any part of your skin that it takes a little bit longer for something to heal?
No, not really.
Okay. Any rashes or bruising that you noticed?
No.
And any changes in moles or any freckles that you have on you?
No, I do have freckles, but they've been the same since as long as I can remember, so.
Okay. So any cough recently or wheezing? Any trouble breathing?
No, not at all.
And for your eyes, do you wear glasses or contacts?
I primarily wear contact lenses, but I take them out as soon as I get home from work, and then I wear my eyeglasses.
Okay. And are you nearsighted or farsighted?
I am nearsighted.
Okay. Do you have any abdominal pain, or do you struggle with any constipation or diarrhea?
No, very regular.
Okay. Any history of hemorrhoids or eating disorders?
No.
Do you have any ear pain, itchiness, or a pulling?
Nope, nothing I've noticed.
Any ringing in your ears?
No.
And do you have any urgency or frequency when you go to the bathroom?
No, not at all.
Any change in color to the urine?
Nope, it's normal.
Okay, if you don't mind, I'm going to ask about your contraception. Do you
Sure.
use any birth control?
I have a Mirena IUD.
Okay, and when was that implanted?
That was implanted in 2018.
And how is that? Are there any cramping from that or unusual bleeding?
No, I see my OBGYN on a yearly basis, and I just went last month and she said everything looked fine.
Oh, that's fantastic. And do you know when your last pap smear was?
It was last year.
It was, okay.
Yeah.
And do you know if it came back?
Came back normal.
That's fantastic. Do you do breast exams in the shower?
I do them every day.
That's
Yeah.
fantastic. That's good. Okay. And when was your last menstrual period?
It was the end of last month, and I'm due to have my period in a couple of days.
Okay. Any unusual cramping, unusual bleeding, or anything like that?
Nothing
that
beyond
comes-
the normal.
Any complaints of vaginal discharge that you had?
Nope.
Okay. So you said you didn't have any allergies, but do you have any sinus problems?
No, I feel like I can breathe fine just right through my nose.
Any trouble swallowing?
No.
Okay. Any irregular nosebleeds?
No.
When was your last dental exam?
I went 2 months ago.
Okay. Any cavities or caries or anything like
I had one cavity, but it got filled already.
that? Oh, that's great. I'll take care of it. Any throat pain, or do you feel hoarse?
No, not at all.
Do you have any back pain?
No.
Or any joint swelling?
Nope.
Okay. Any stiffness in the morning or fractures?
No.
Have you ever fainted unexpectedly?
No.
Okay. Any history of seizures?
No.
Any numbness or tingling or anything like that, or weakness?
No.
Have you ever been tested for HIV?
No.
Okay. Any unusual bleeding?
No.
Any history of blood transfusions?
Nope.
Have you ever had any swollen glands?
No.
Increase in thirst? So you've talked to me about your thyroid and
Yeah.
you're managing it well. No difficulty swallowing or anything like that?
No, I've never actually felt it being enlarged. I haven't had any difficulties with my swallow function from it.
And just lastly, we're going to talk about your mental health.
Sure.
Have you ever suffered from any form of depression or anxiety?
No.
Okay. Any trouble sleeping?
No.
And have you ever had any suicidal ideations or thoughts?
No.
Okay, that's great. All right. So next we're going to move on to the physical exam part.
Sure.
And we're going to start with the mini mental health exam.
Sounds great.
All right. Okay, that was. Hello, hello, hello. Okay, great. So we're going to move on to the second part of the exam.
Sure.
This is the mini mental state exam. It kind of just gives me an overview of your mental status, okay?
Sure.
All right. So first we're going to ask a couple questions,
Mm-hmm.
and I'm just going to ask you to repeat a few things too.
Okay.
Firstly, what is the year?
2021.
And how about the season?
Winter.
Okay. And the date today?
Today is February 24th.
That's fantastic. Okay. And what state are we in?
Connecticut.
How about the country?
The country is the United States.
Good. Okay. That's okay. It takes me some time. What about the town?
Hamden.
Good. Okay. So I'm going to say 3 objects,
Mm-hmm.
and then after I say those objects, I'd like you to repeat those 3 objects back to me, okay?
Okay.
Are you ready?
Sure.
Rose, cup, ball.
Rose, cup, ball.
Now, the next part, I'm going to ask you to count back in from 100. You're going to minus 7 from each number, okay? okay?
Okay.
This is called your serial sevens.
Okay.
So starting from 100, you're going to count back 7.
Okay.
Okay?
Sure.
Can you start for me?
Okay, so 100, 93, 86, 79, 72, 65, 58.
Okay, that's great. That's good.
Okay.
You did more than you had to, so that's fantastic. Okay. You remember those 3 objects I told you before?
Yes.
Can you repeat them back to me?
Yes. Rose, cup, ball.
Okay, good job. Okay, now I'm going to ask you a few more questions.
Sure.
I'm going to point to some things, and I'd like you to tell me what it is.
Sure.
So in my hand, what do I have right here?
That is a pen.
Okay. And on my wrist, what would this be called?
A watch.
Good job. Now I'd like you to repeat the following. No ifs, ands, or buts.
No ifs, ands, or buts.
Okay, good job. Okay. Now I'm going to give you a command, and I put a piece of paper out on the table.
Sure.
After the command, I'd like you to do what I've asked you to do, okay?
Okay.
Okay. I'd like you to take the paper in your hand,
Okay.
fold it in half, and then put that folded piece of paper on the floor.
Okay. And on the floor.
Thank you. Good job.
Thanks.
Okay. Now, I'd like you to read this cue right here, okay? Read what it says, and then I'd like you to also do what it says.
Okay.
Can you read that line right there?
It says close your eyes.
And can you show me that? All right, good job. Okay, now I'm going to give you my pen,
Sure.
and I'd just like you to write a sentence. The sentence could be anything, and you can write it there on that piece of
Okay.
paper.
Put my name is Jacqueline.
Great.
Can I come back?
Thank you very much. Okay. Now I'm going to show you a design,
Sure.
and I'd like you to copy that design.
Okay.
Okay? The design's right here. You can use my pen and the paper I provided,
Okay.
and you can try and copy that design right there.
Sure.
Okay? Okay, nicely done.
Thanks.
Okay, so you scored a 30, which is a perfect score.
Awesome. That's good to know.
Okay, good job. Now we're going to move on to the physical exam portion of this exam, okay?
Sounds good.
All right, thank you. Hi, Jacqueline. So this is going to be the physical exam portion of the test, okay? And then this part of the test, I'm going to have to put hands on your body. Is that okay?
Yeah.
Okay, great. So first I'm just going to go ahead and inspect your hair.
Okay.
All right, I'm looking for the texture and the distribution or any pattern of baldness, okay? And then I'm going to be looking at your skin for temperature, texture, and turgor. Along your skin lines, I'm looking for any warm, dry, pink skin, or any alterations of that. Moving on, I'm going to look at your nails for any edema, pitting, or clubbing.
Okay.
Great. From there, I'm going to go ahead and palpate your scalp, okay? And your scalp is evenly distributed, your hair is evenly distributed across your scalp, without lesions or nodules, no evidence of infestation or dander. Your head is normal cephalic. Okay, from there we can palpate your temporal arteries. Okay. Moving on, we're going to palpate your sinuses, okay? We're going to palpate your frontal sinus and let me know if there's any tenderness.
That feels just fine.
Okay, how about right there?
That feels good too.
Good job. Okay, from there, we're going to move on to the lymphatic chain, okay? I'm going to feel for your preauricular lymph nodes. I'm going to feel for your parotid, your postauricular, your occipital, your tonsillar, submandibular, submental, superficial cervical chain, posterior cervical chain, deep cervical chain, and superficial clavicular. And we're looking for any hardness or firm lymph nodes, okay? Which we don't feel.
Good.
Great. Okay. Now I'm going to be looking at your neck. I'm going to be looking at your neck veins for any jugular venous distension, which I don't see. Now, if you could swallow for me. Okay. So your trachea and your thyroid are midline. I'm just going to go ahead and palpate your trachea.
Okay.
For your thyroid gland. First we feel for the cricoid. And just right under, if you can swallow one more time for me. Great, that rises the thyroid up and I can feel the lateral borders of it. In your thyroid, we're looking for any growths or nodules. Good. Moving on from there, we're going to inspect your eyebrows.
Sure.
Your eyebrows are thick, the distribution is good. So we're looking for texture and distribution. We're going to be looking at your eyelids. Okay, looking for any redness or swelling.
Sure.
I'm going to be palpating around your eyelid for any tenderness. Any tenderness?
No.
Good. I'm going to press right next to your eyelid where your puncta is to see if there's any discharge from your lacrimal ducts. Okay, and see if anything is obstructing the lacrimal gland or the puncta. Okay, great. Next, we're going to test and see your pupillary reflex. I'm going to shine a light into your eye, okay?
Okay.
All right, first we're going to test for direct pupillary constriction and then consensual pupillary constriction. Okay, good. And now consensual. Good. Pupils are equal, round, reactive to light, and accommodating. Next, we're going to look inside of your eye.
Okay.
We're going to look at your optic disc and your arteries in your eye. Okay. Okay, good, good. Your eye, your disc margins are sharp. There's no hemorrhage or exudate and no arterial narrowing.
Okay, great.
Okay. From there, we're going to go ahead and move to the ear exam. Okay. So I'll be switching tools.
Sure.
So I'm going to switch to the otoscope. We're going to look at your ears.
Okay.
Okay. And we're looking for any injuries that could, or redness or swelling before I put the otoscope in your ear. Is there any tenderness when I touch your ear like that?
No.
Okay. I don't see any injury, so I'm going to go ahead and move forward with the ear exam.
Okay.
Okay. So I'm going to pull your pinna up and back as I insert the otoscope at an upward angle. And I'm looking for cerumen, exudate, arrhythmia, and I'm looking at your tympanic membrane, which is pearly gray. I don't see any bulging. And now we're going to go ahead and look at your side. Same thing, we're going to look for any injuries or exudate or swelling. Pulling your pinna up and back. And both tympanic membranes are pearly gray, white, pearly gray and no discharge, translucent. I saw the cone of light at 5 on the right side and 7 on the left side.
Cool.
And the landmarks are clear and there's no perforations, arrhythmia, or lesions noted.
Okay, great.
Okay. Next, I'm going to take this tool. It's called a tuning fork.
Okay.
I'm going to use this tuning fork and we're going to do 2 tests. We're going to do the Weber test, which tests for lateralization.
Okay.
Okay. And then we're going to do the Rhines test. Okay.
Okay.
And that tests for air conduction versus the bone conduction.
Okay.
Okay. So the first test, I'm going to hit it on my forearm.
Yep.
Put it on the top of your head.
Mm-hmm.
And you're going to tell me that if you can hear the ringing.
Yes.
Okay, good. Can you hear it equally on both sides?
Yes.
Good. So lateralization. Then we're going to go ahead and move on to the Rhines test. Okay, I'm going to stick it on your mastoid process. Can you feel that? And let me know when you stop hearing it.
It stopped now.
Okay. Can you hear the vibration in your ear now?
Yes.
And let me know when you can stop hearing that.
Now it's gone.
Okay, good. So in the Weber test, there's no lateralization. And then in the Rhines test, your air conduction is greater than your bone conduction bilaterally, right? So we're going to test your other side to make sure. Okay, testing on your mastoid process. And let me know when you can hear that ring and stop.
It stopped.
Okay, and the same thing. Let me know when you can hear that ring and stop.
Now it stopped.
Okay, good. So bilaterally, your air conduction is greater than your bone conduction. Okay. So I'm also going to whisper a word behind your ear, and if you could just repeat that word to me, okay?
Sure.
Standing 2 feet away, after I exhale, I will whisper a word, okay?
Okay.
World.
World.
Good. Okay, I'm going to do the same for the other side, okay?
Okay.
Exhaling before I say the word. World.
World.
Good, good. Okay. Moving on, we're going to look at your nose.
Okay.
I'm going to inspect the bridge of your nose for any deformities or deviations. Okay. Then we're going to look inside of your nose.
Okay.
Turning the otoscope on. I'm going to look inside of the nares. Looking for the turbinates and the septum. Looking for any arrhythmia, exudate, or edema. Okay. Good. Good. All right, the nasal mucosa is pink. The septum is midline. And was there any tenderness around your sinuses?
No, not at all.
Okay, good. Finally, we will be looking at the mouth.
Okay.
So I will be looking at your lips for any indication of dehydration, like cracking.
Okay.
Okay. I don't see anything like that. If you could open up your mouth. Okay, I'm looking at your buccal mucosa. I'm looking at your dentation. I don't see any caries or cavities. I don't see any ulcerations or lesions. If you could stick your tongue out for me and up. Good. Looking for papillae. Great. Okay. Your buccal mucosa, your gums, there's no bleeding around your gingivitis. Your gingiva. There's no bleeding. Your mouth is moist. Your tongue is midline. If you can stick your tongue out and say ah for me. I'm just going to shine in.
Sure.
Looking at your uvula and your soft palate as it rises. Midline, there's no deviation. Okay, you can put your tongue back. The tongue is midline, there's no lesions noted on the ventral surface or the sublingual area. Your teeth are clean, like I said. No absent teeth noted. No lesions on the soft palate. Your uvula is visible. I didn't see any edema or arrhythmia noted.
Sure.
And your tonsils are present. And there's no exudate or swelling on the back of your throat.
Good.
Okay. Do you have any questions or anything I can answer for you?
Not at this time.
Okay, great. So that will conclude our physical exam.
Great, thank you.
And it was great meeting you.
Yeah, nice to meet you too. Thank you
you.
so much.